Time now for our daily rising crisis update. Let's start with the latest in terms of numbers and what we know here and around the world. So here in the U.S., we're up to 1.5 million cases. That's an addition of 21,700 since yesterday. Deaths have hit that 90,000 mark, although we were under 1,000 deaths since yesterday. So an addition of 791. Still a lot of people dying, but that is a decrease from what we've seen. Around the world, 4.7 million cases. That's an addition of just slightly less than 100,000 since yesterday. Deaths are at 318,300, an addition of 3,211. Look, you don't want to read too much into one day's death or case load total, but, some encouraging declines there that we'll keep an eye on.
Yeah, it's good. It's almost 3 times less than what it was last week, the daily average total of around 2,000. So that's exactly something we want to be looking at. At the same time, President making some news yesterday. He was asked if he's taking hydroxychloroquine, which is it's involved with malaria anyway. So some doctors have said that it was a drug that may have served as a therapeutic or to stave off from coronavirus, saying that he requested the drug from the White House physician who put out a letter yesterday saying that he approved the president's usage of the drug. Of course, it's a drug you can only get through prescription via your doctor. Some people were very concerned. There was a big media freak out over this. It's one of those particular ones. A lot of people saying that, look, there are higher risker populations that hydroxychloroquine may not work for, but in those cases, doctors would simply just not prescribe them. So it's going to remain on a case-by-case basis. The data in terms of usage or not usage is very much
very mixed.
Cards there. It's very mixed. I mean, in some cases, it did certainly help people. In some cases, it hasn't. Remdesivir seems to be, as I understand it, to be a much more of not a cure-all, but more of a better therapeutic in getting people through coronavirus. Hydroxychloroquine was initially thought as a possible remdesivir-like therapeutic for all patients, now looking more like a case-by-case basis. And Trump, I think he's been taking it for about a week and a half, according to the White House physician's letter that was released yesterday.
Yeah, and they were like, why didn't you tell us? And he was like,
you didn't
ask. I mean, it's pretty crazy for the president to be taking something that is untested, and that even the tests that have been conducted are more around if you have coronavirus, that this can help you. He's, we assume he doesn't have coronavirus, taking this as a potential preventative. So it is kind of a wild situation. But yes, of course, people melted down and lost their minds as they do.
So first, half the MAGA right have now become doctors and are hydroxychloroquine experts. And the left are now also doctors who say, it's going to kill you. It's obviously somewhere in the middle, folks.
And also, the people who are feigning concern, trolling the most care and concern for his health are also the people who, care the least about his health, I'm quite sure. So.
Yeah, right. So, okay.
Anyway, we wanted to update you on that development. Another story that we've been following really closely here involves Amazon and their treatment of workers, what they've been doing in order to protect or failing to do in order to protect. Of course, we've had organizers here on the show who staged protests because they felt that the company was not taking their safety concerns seriously. We've seen some of those work actions crop up across the country. New York Times has some new reporting on one Amazon warehouse in particular. This was in Hazleton, Pennsylvania, where they ended up having a huge outbreak. Now, we don't actually know exactly what the numbers are in terms of workers because Amazon hasn't been forthcoming with that information. But they're guessing somewhere around 500 workers. Nationwide, it looks like somewhere around 900 workers, Amazon warehouse workers, have been sickened with coronavirus. One of the dynamics that I think is really important within this story that I encourage you to go and check out, and it's well reported, is the disparity between the protections put in place very quickly for the white-collar Amazon workers versus the blue-collar Amazon workers. So a month after the white-collar workers were told to work from home in Seattle is when they started to do anything at this warehouse and likely other warehouses around the country. And even then, it seems, according to this reporting, to have been woefully inadequate. And of course, we see the results with many, many workers sickened. The hand sanitizer that was supposed to be there wasn't there. They never shut down to do a deep cleaning. They weren't able to implement effectively social distancing techniques. It took a lot of pressure to even be able to get, an extra break for workers. So all of these pieces, again, just show that potential disparity between the treatment of the white-collar Amazon workers, the blue-collar workers, which is endemic. This isn't just an Amazon story.
No.
This is like the story of our economy right now. Who is being put at risk and whose lives are being seen as worthy of protection?
Yeah, certainly. So we're going to keep everybody updated on that story because we don't have a full scope of how many of these Amazon workers do have coronavirus.
No, that's exactly right. All right, we'll be back tomorrow with another crisis update. Please subscribe so you don't miss it, along with liking and sharing the video so others see it as well. Thank you for watching. We'll see you back here later.